Now, the health crisis is deepening.
Thousands of doctors have stayed away from hospitals over poor pay and working conditions.
Alice is back at the hospital for the second time this week, hoping to get a prescription for antibiotics.
Have you taken any medication?
No. When I came, the pharmacist, because the drugs were not there.
Across many parts of Kenya, reports of county hospitals running out of supplies are all too common. Health workers go unpaid, and clinics wait for months on end for essential equipment. But what's really behind this crisis?
One time I was in a county, I was doing research work. So I had booked an appointment with this health worker. When I got to that facility, it was on a Maram road, several kilometers from the county headquarters. The health worker was alone in a health center, like there was no other health worker there. And in addition, they had a baby who was in critical condition, needing referral. They had called for an ambulance, but that ambulance did not come. So we were all seated because you can't interview someone when they're in that state. So we were all seated, and at some point I said, why don't you just take our vehicle, the one that brought us here, and refer the baby? But it was a very tricky situation because they were alone. Would the baby go alone without any other medical professional? And will she leave the hospital unattended? And just when we were thinking through how do we go about this, 5 minutes later, the baby died.
According to the 2023 Health Facilities Census by Kenya's Ministry of Health, a staggering 93% of the country's health facilities are unable to provide basic outpatient services. The nationwide survey, covering over 12,000 facilities, revealed that most lack even the essential equipment required for day-to-day care. In maternity services, the situation is just as dire. 84% of nearly 5,000 facilities are missing critical tools. It's challenges like these that compelled Dr. Anita Musiega to investigate how public financial management could be the key to unlocking better healthcare for all Kenyans.
As a country, we invest a lot of money into healthcare, but how does this money translate into healthcare for people? How does it translate into purchasing health for people? The role of government is to collect money together and use that money to purchase public goods. And one of these public goods is healthcare. I worked as a nursing officer intern at one of the biggest referral hospitals in this country. And while working there, I was confronted with some of the challenges that frontline health workers and by extension patients face. Lack of resources, lack of commodities, patients can't buy medicine, a patient is stuck at the ward for 4 or 5 months, they can't afford orthopedic equipment. So, and most of this is because the money we have cannot translate into health. So my PhD sought to explore how do we ensure that the money we have as a country actually translates into health. And while the money is little, we need to make the best use of that little that we have.
Anita Njemo Musiega.
Anita recently earned her PhD from Strathmore University Business School with a groundbreaking study titled Examining the Influence of Public Financial Management Practices on the Efficiency of County Health Systems in Kenya.
Currently, the counties actually structure their budgets well. They use a program-based budget that seeks to link the available resources to outputs. However, sometimes you see a bit of challenges in the definition of those outputs. Sometimes it's not a health output that's put in that budget. Sometimes you'll see that a meeting that is attended is an output, and equipment that is purchased is an output. That's an intermediary output. We need to get to the outcomes and say we are purchasing this equipment to improve the healthcare of people. And while the budget formulation is done well, there are significant challenges in how the budget is executed and how accountability processes come into place. In the monitoring and accountability systems, sometimes you hear budget audit reports, you hear, oh, this county has misappropriated money, but do we ever get to incentives and disincentives, punishing people for that misappropriated money? And when you don't punish people, somehow that just builds a culture of lack of accountability. Any misappropriated money within healthcare, it translates to actually killing patients, denying patients much needed healthcare. And I think that's something that people in leadership actually really need to internalize and know that money meant for health, when it's not there, then people will die.
Public financial management might not make the headlines, but it quietly determines the state of healthcare in Kenya every single day. Dr. Anita Musiega's research is a powerful reminder. Behind every policy decision, every delay, every disbursement are real people waiting for care. If we hope to build healthier communities, it begins with building healthier budgets. If this story inspired you, share it, talk about it, and let's demand better systems together.